One of the most common reasons that women come to the gynecologist is for abnormal vaginal bleeding. And so before we talk about abnormal vaginal bleeding, I thought it'd be important to explain what normal vaginal bleeding is. And so of course it's normal for women to have normal menstrual cycles every month. But what a normal menstrual cycle is a little bit different for every individual. In general, about once a month, a woman should have a menstrual cycle. Now we usually count periods from the first day of one period to the first day of the other. And honestly, anything from a 21-day cycle to a 35-day cycle is considered normal. Now, people that have 21-day cycles generally aren't too happy about it, but that is considered within the normal realm. 28-day cycle is considered the ideal menstrual cycle, and that's this idea that you ovulate on cycle day 14 and you have the normal 28-day cycle. And that's the idea of it kind of goes with the phase of the moon. But the truth is most women don't have exactly 28-day cycles. And so if you're only having, say, a 25-day cycle or a 21-day cycle, that's still considered normal. And the same thing if your cycle is 35 days. Most women don't have exactly the same cycle length every cycle. So you might have a 25-day cycle, and then a 28-day cycle, and then a 26-day cycle, and then a 32-day cycle, and that's totally normal. So it's okay to be off by a few days here and there. It doesn't mean that anything is wrong with you. Now what about cycle length? So the average menstrual length is about 5 days, but some women only have 3-day menstrual cycles, some women 7-day menstrual cycles, and anything in that range would be considered a normal length of menstrual cycles. So abnormal bleeding could be that you're bleeding too frequently, it could mean that you're bleeding for too long of a period of time, or it could mean that you're bleeding in between your periods, and any of those would be considered abnormal. Abnormal bleeding could also be that your bleeding is spaced out too much. So you might go 3 months without a period. That would also be abnormal. The other thing that's very hard to quantify is how much bleeding you're actually having during those bleeding days. And so women will just tell me that their periods are very heavy, or their periods are light, or they're in between. But you really only know what your periods are like for yourself. And so some people say, well, I've had heavy periods all my life, or I've had light periods all my life. Well, that may be true for their experience. They've actually done studies of this, and women are very poor at actually judging how much blood they're losing. And so it's just as likely for someone who thinks that their periods are heavy to have a small amount of actual blood being lost as women who think that their periods are light. However, you know what your periods are like for yourself. So if you always have sort of what you consider a light period, and then you have a very, very heavy period, that's a change, and that for you is abnormal. So the actual amount of blood loss is a little bit less important as the change in your normal pattern. And so you eventually find out what's normal for you, and then you can say what changes are for yourself. So an abnormal bleeding would be, by definition, bleeding that's happening more frequently than 21 days or less frequently than 35 days, that lasts more than 7 days or lasts less than 3 days, or bleeding that's happening more than once a month. So some women will have 5 days of what seems like a normal period, and then a week later they have another 5 days of bleeding. That would be abnormal bleeding. So those are the kind of things that you should come in to discuss with your doctor. Now, what about women that aren't bleeding enough? That actually can be a problem too, believe it or not. And so if you go more than 3 months without a menstrual cycle, that can be dangerous and is actually a risk factor for uterine cancer. So you never really want to go more than 3 months. Now, if you're going long periods of time without a period because you're being treated with some kind of medication that's stopping your period, that's a whole different thing, and that's safe. But if you're not being treated with hormones to stop your periods or to lighten up your periods, but if you're on no medication whatsoever and you go more than 3 months without a period, that's potentially dangerous, and that's something that you should come to the doctor for as well.
Medtwice.com